dealing with your issue and your element? What was the thing that kind of really hit you, that set you back?
Well, so I had breast cancer. And I will say bodybuilding saved my life because I was about 5 weeks out from a show and I was getting lean and I was putting my posing suit on to practice and I was adjusting the top and I'm like, what's that? It's something. And sure enough, make appointment after appointment after appointment. And it turned out to be breast cancer. And the doctor, without missing a beat, you need a mastectomy. And it's up to you if you want to double, or I was about to say triple, a single or a double, because it was only on one side. But I opted for the double for, fear of recurrence, symmetry, all sorts of things. So that's what I did. So, obviously I didn't compete that year, but I did compete the year after, and I was diagnosed in 22, and I got my pro card in this year in 25. And even though I went back and competed, I think it was good mentally to get back in the game. But I had lost. I didn't really respect the disease and the disease process and what it did to me and the treatments. I'll get to the treatment, but I lost a lot of muscle. And so I could still work out and I got lean.
I apologize. I have 2 dogs and
that's okay. Mine are the same.
Everybody's out at one time.
And so I didn't realize that I had lost that much muscle because we all have body dysmorphia in this hobby, right? So none of us think we're ever big enough or whatever. So I didn't really know that I had. So it took a couple of years to build it back. Also, what happens is, so I didn't need chemo or radiation, which I am thankful for, and all my breasties who do go through that, you're the true warriors. But my treatment is medication, and it's 1 milligram of anastrozole a day for 5 years. You have more estrogen, George, in your body than I do. You actually have more breast tissue than I do, but like I'm write that right now. I can do it. So another side effect of the anastrozole is joint and nerve pain, which it comes on at first, then it subsides, and now it just flares every now and then. Like I'm going through a flare right now, and it seems to concentrate in my hands, and right now it's my feet, the balls of my feet, and my back just hurts all the time. It's just a part of life now, and I'm on this medication for 5 years. So it's sort of it impacts training, and that I can't recover as well because I don't have any estrogen, and estrogen is huge in recovery. But I am not willing to let the disease win, no matter if I'm in pain or not. And in fact, going and training takes my mind off the pain a lot of the times, or it just feels like I'm conquering it on some level, that I can, you're not the boss of me. I'm going to go do this. I'm going to go drag myself in pain to the gym and bust my ass and build as much muscle as I can, because that's who I am. And that's one thing that cancer is not going to take from me. Not yet anyway. So those are and then there's the challenges, the mental aspect of, I'm in right now what they call the long shade. So at first, when you're diagnosed and you're confronted with your mortality, and every night is a panic attack. Everything you're scared of everything. And then you make it through, 6-8 months. You're like, okay, I'll probably make it through the night, and so things start to settle down a little bit, but it's always there, right? And different triggers, like when I'm in pain, it'll trigger some of the fear and all of that again. Like, oh, when's it going to come back? When's it going to come back? It always sits on your shoulder. Sometimes you forget about it, and then something will happen, or all of a sudden you remember, oh, this is what separates me from everyone else. So that are the things that we go through. I will say I'm fully reconstructed. I've got implants, and my favorite thing is I don't have nipples, so I will make jokes about that and all of that. And I also got bees tattooed because they're not my new boobies. So I don't know why I'm like this. I just can't help it.
Well, what we do is we'll pull up something from we can go to Whitney's IG, and this is where she is right here. You want to check her out, you can follow her, but guys, you know my rules. And that's a tough part, especially for a woman, because being breast is very important part of the physicality of a woman. It
Right.
here she is after your surgery. Here's the reconstruction. I mean, it's tough. That it's like being kind of if you know you're a dog lover. It's like taking your dog getting spayed or neutered. Here she's a cute little dog.
I had AI do me as a dog, like
Oh,
to make me a dog. And I was
that's
not terribly pleased, but
What a cute little dogs here. And this thing is a process. Bodybuilding, I think, is one of those sports that's really like right here. This is from I think last year, and this is from we just got a little bit right before you got your pro card. And you
these
really
are
see the
both this
difference.
year.
This
Yeah,
year, oh wow, okay.
they're both. Yeah, the one on the left is the first show, and the one on the right is the second show where I turned pro.
Oh wow, yeah. You look like you really evolved. You're a lot, but yeah, you are somebody who's also advocate for other women who's dealing with issues with cancer. Because I follow you also on
Thank you.
on a TikTok. You
Yeah.
talk about you talk about the subjects where how people often don't understand what you're going through as a woman dealing with severe case of being a bodybuilder and also surviving breast cancer, because that's one of the I think it's number one killers of women
Yes,
in the
it's the
country.
most common form of cancer for women. 1 in 8 women will develop breast cancer. So,
Yeah,
yay!
yeah,
I'm one of
yeah,
the
yeah.
12%.
Well, that's
But
it.
because it's 1 in 8, everyone knows 8 women, right? So you know someone who's affected.
Hmm. Like like a cousin, friend, sister, like that.
Yeah.
I got my sister, my oldest sister. She's right now. She's dealing with leukemia, and she's doing all right. She's because she's kind of like been like when I was growing up, my mom and dad used to have to work, and she was kind of the foster mother to us younger kids, especially me and my younger brother. We were the last two, and when she told me that, I cried because I saw her. I just lost my mother not that long ago, and then to lose somebody else who I love dearly, because I lost one sister and a brother, and it's tough to see them go through what they went through. Because my sister had a stroke, my sister married, and my brother James is going through some medical issues himself. So,
But
Randy,
they've made
share.
huge strides in leukemia, though. Just to say, I know they've
Yes,
made huge strides. So
yeah, I appreciate that. So, Randy, share your story and what was your disease, your ailment, and what in your experience as a bodybuilder.
sure. So first of all, I want to say, like, Wendy, you are just incredible. I had seen you on George's podcast, um, and I think you did Dave's too, right? Were you on Dave's podcast? Did you do that?
yes,
Yeah.
yes, yes.
Okay. So I think that was the first one, and like just automatically, I just like resonated with you.
Yeah.
I think that you are totally badass. And I'm very much the same. That bodybuilding has given me um, just so much hope. If I wasn't doing this, I don't know how I would be. I think that my family thinks at times that I am crazy. I do. To my right of me, I'm going to drag her in here in a minute, and she's going to be really pissed off at me. But I have a special guest. My daughter is actually here. She's getting married.
Oh,
Getting married November 1st, so she's here looking at some photos and stuff like that. So Jessica's been with me through this whole journey. So what happened was it was 5 years ago, September 6th. It was just right after things started to open up, during COVID. So, back up a little bit. I was a nurse. I practiced nursing for 24 years. I've retired from nursing about was it 2.5, like almost 3 years ago, where I decided not to renew my license. I just decided to just put that behind me and go back into personal training and do something that I love helping people, and I love making a difference, and I want to do it in a positive way. So I decided to do this. So I was in the gym and I had worked a shift, and during COVID we were working so many hours. So people would ask me, did you have symptoms before? I don't know, because I was tired all the time. I worked 90 hours a week in full PPE, putting my life on the line, just like every other first responder. Sometimes we would walk into facilities and didn't know. Sometimes we weren't even given PPE, and I had to rely on like whatever I had. So I was exhausted when I would come home. I didn't know what time of day it was. I only knew what day it was because I had to go to work. So I was like Wednesday because like other people were like making sourdough and they had no idea like what day was what. I tried to train like a little bit through it and I just kind of gave up and I couldn't. So as soon as things started to open up again, I started training and going back to the gym, and I had made the decision, like I had put on a lot of weight, not in a good way. And I had said, I'm going to do this. So we started training for a show. So it was very strange because my husband's not a huge exerciser, but he had gone to the gym with me on that day. And it was like a Sunday and it was weird. And it was Labor Day weekend and he never does this. And I got off the treadmill and I just looked at him and I said, I don't feel good. And I went into the bathroom and I felt like I was really shaky and I thought it was my blood sugar. And I got into the bathroom and all of a sudden I just dropped to my knees. I was by myself and I splashed water on my face and I came out of the gym and I was crawling on the floor. And I said to him, something is very wrong. Something is very wrong and I don't know what this is. And he looked at one of the kids that was working on the floor and he said, my husband's also in the healthcare industry. He's a respiratory therapist. And, he had said, I think you need to get the AED. And he kind of mouthed it because he was afraid that, he's down listening to my lungs. He thought I'd collapsed a lung. And it was my heart. And he called and they said, no, she's having a heart attack. And he was like, what? She's a bodybuilder. I don't get this. She trains all the time. And she's in the gym and like, I don't understand this. And she's been doing this for like, 3 years already. And she trains 7 days a week. And how can this be? And I guess my color had changed and I got very gray. And I had what they call a widowmaker, which is one of the worst heart attacks that you can have. So my right side was 100% blocked. So George had talked about his ejection fracture before, which is like the percentage of kind of like what your flow is in your heart. So mine was like less than 10% on that side. So they looked at said, well, they said, you're going to the cardiac cath lab. So like they took me to a local hospital and they had the team on standby. And I remember the doctor looking at me and going, okay, well, if you don't sign this consent, you're going to die. And if you do sign this consent, you could die. I'm like, what the fuck? Okay. I'm like, well,
Nothing to lose. Yeah.
Damn if you do, damn if you don't. That's a fact to me.
So like I'm signing the consent and we're going up to the cath lab. And then they ended up placing 2 large stents in me. And at the time I had just turned 50. I just celebrated my 50th birthday in July. And, nobody could believe this, like I remember my daughter saying to people like, how can this be? Like my mom is really healthy and I don't understand this. And this can't be the way. And like, I don't get it. So, I went through the process of recovery. It took me probably about 3 months or so to like kind of go through the rehab. I did not go to cardiac rehab. My cardiologist was like, you can rehab yourself, girl. So I just started walking and then I started like walking in the water and doing like water walking. And I would go as soon as the doctor cleared me, I would go to the gym just to walk twice a day, just to like Wendy was saying, like being in the gym and like getting into your own head. Like I needed to do that. But I mean, I remember the day after a heart attack and not being able to like transfer from the bed to a commode to go to the bathroom. I remember my daughter holding me and not being able to walk 5 feet without getting winded. So going through that whole process, but I just decided, and I was a smoker at the time. So, I immediately gave up cigarettes right away. It's been over 5 years since I've had a cigarette. That is over and done with. Um, thank God I praise, whoever your higher power is, like, the fact that I'm here. I guess people always say that there's a reason I'm still here, you know. Um, and I just thank God that I was in the shape that I was in because they said to me, you shouldn't like be here, period. Like you shouldn't have made it through what you did. And I think it was just like will and determination. I also think that I wasn't there. I wasn't ready to give up. I knew that in life that I had other things that I had that were going to happen. I only have one child. And I knew that at some point that she was hopefully going to get married and have children one day, and I very much wanted to be a part of that. So I wasn't going to let her down, you know.
Yeah.
I was gonna be there for her. So we all got through it together. I rehabbed, and I decided to like prepare for a show. I live in the Boston area, so I was gonna do one of Jay's Cutler shows, and I wasn't ready. So we went to Virginia, and I won women's physique overall, and it was pretty freaking cool, you know. And I competed against like 6 women, and I was like, wow, I did it, you know. So now I went and I trained, and then I went to Masters National in 2022. And then I placed 3rd and 4th in my classes, did really well. I was so proud of myself. Just, you know, I didn't give a shit. Like I made it, you know what I mean? Like I didn't care about winning the pro card. I won life, you know, I'm like, I'm here. So we started to train and decided to go again and go, you know, maybe do the universe or head towards like the next national show. Well, then I think the universe was 2023, and I got diagnosed with thyroid cancer. I went in for a checkup to my doctor and I was going out of my mind. And I said, if you don't put me on something or give me something, I'm gonna kill. Because like Wendy was talking about, like having like no estrogen, my estrogen zeroed out. It was stupid low. And I just was like, and my doctor at the time was like, no, we'll put you like on an antidepressant. And I'm like, I'm depressed because I don't feel good. But he was in there doing his examination and he felt something. And so he sent me for an ultrasound and he's like, I don't think it's going to be anything, but like, let's see. And then we ended up going and having the biopsy done. And they were like, well, you'll get the results, you know, but I could tell by the radiologist who did it that it wasn't good. And then it was like a week later to the day that the doctor called me and I was training in the gym and he's like, let me tell you why this is papillary thyroid cancer. So I said, well, you know, maybe I'm like, I got a show to do and I don't have time for this. Like cancer doesn't fit into my equation here. So what we did is I said, well, how long? And he said, I think you need to do this sooner than later because it could spread, you know? So I was so grateful. You know, my daughter went with me to the oncologist. We saw a surgical oncologist and she went with me. We went to Brigham and Women's, saw one of the top surgeons in the country. And she was awesome. She spent like 45 minutes with us. And I had the option of either having a partial thyroidectomy or having a total. And I asked the doctor and she's like, well, it's really up to you. And it actually was my daughter. You know, I looked at her and I'm like, Jess, what do you think I should do? She goes, Mom, I think you should have your thyroid taken out. I think, what if there's more cancer or whatever? She goes, we'll deal with whatever it is, but I think that you should do this. So that's what we did. I had my thyroid out and that was tougher to recover from the heart attack because as you know, like, you know, I'm in my 50s, I'm going through menopause and now I don't have a thyroid, which controls everything. It was so much worse than the heart disease. Like the heart disease, I felt like I could fix. This one, like I couldn't fix. So like on came the weight gain and all the things and getting my levels straightened out. So I ended up switching doctors and I have a wonderful doctor right now who put me on hormone therapy. And you know, I had a hysterectomy years ago, so I don't have a uterus, so I'm not at risk for uterine cancer. And, you know, you do get, because once you've had cancer, it can pop up in other places. Thank God. I always get nervous about breast cancer because that's huge in my family. My grandmother had it. My aunt just went through it. But she did all the gene testing and thank God we don't have the BRCA gene. So, you know, I was grateful about that. But anytime, you know, and people would actually say to me, well, you know, if you're going to get cancer, this is the best type of cancer to get. I was like, I'm like, okay.
I like this. There's no, it's like when I hear, like, I used to watch this thing. It was called Scared Straight. And there are these guys in the prison talk to young boys saying, like, you know what's the next best thing to a woman? It's a young boy. There's no next best thing to a woman. So
I mean,
there's no next best thing to a cancer. All of it's bad.
Right, like a little pregnant, you know what I mean? Like, cancer is cancer, and it doesn't matter. And you hear that word, and you shut down, and it was a horrible. It just the whole recovery was. I think it was more mental than anything else. And I was very, very fortunate to have the support of my family to help me with that, but. It caused weight gain and just all sorts of stuff. And so now, like, actually, it was like between the diagnosis with the thyroid cancer, it was about a week before my surgery. I had a small stroke. Right? I just, and
Give her a pro card. Just for life.
It's like that old. I used to kid. One the show I used to watch as a kid called Hee Haw. If I remember, if y'all
Yeah, I remember
Hee
that.
Haw,
I remember
you remember it wasn't no bad luck. You have no luck at all.
That's
right.
right.
Exactly. So like we went through that, we had that, and then we had the thyroid out. And then about 6 months ago, I had a melanoma here that everything is okay, and we took care of that. But it's scary. And then with my heart, they diagnosed me with something called sick sinus syndrome. So my heart rate will go extremely low. It can go into the 30s, and it kicks in right before like I get into that vasovagal response. So thank God. So eventually my treatment will be a pacemaker. I just met with a specialist for the second time, and not yet, but he said definitely like down the pike, I'm going to have it. And like, we'll deal with it. But my cardiologist is really funny. He's like, we're going to just have to talk about your training, because most patients I don't need to have this discussion with.
I know when a while back, I was doing some work. I was training. I was going Planet Fitness. I had a situation part of my situation, I wasn't drinking enough fluids like I was supposed to, and that's why I had that setback. But yeah, I can tell you, it's something that
It's
you got to get used to it.
scary. It's so scary. So I mean, eventually, like that's on the horizon. But thank God, right now we don't. I'm not really thinking about that. And like you said, Wendy, it just like sometimes you forget about certain things, and then all of a sudden you could be sitting here and doing nothing, and then all of a sudden you start to think about, oh my God. But being able to get back to training and training and just that mindset of just being in there and competing against myself and doing the best that I can possibly do. And I want to be healthy, and I want to be here. And this is all about me. I already feel like I want a pro card. I'm here.
Yeah.
So
Yeah, like that.
if
Yeah,
we could,
here you're still standing. That's what
yeah,
we got here. We got here a comment
Fighting.
here. Shout to my man here, Josh Simpkins coming through, says, happy Sunday fun day, George. Appreciate it. Also, my man KL the Wanderer coming through. He says, good afternoon, too, brother. So, folks, we're gonna jump into Randy's IG for a bit. You know the rules. She has a husband, she got a kid. You don't be seeing some funky shit. And and she is really coming her way, because she sent me this morning, and it's wow. You really see you have really, like look at the details of her shoulder, her back. I mean, your condition's done pretty good. She's like 9 weeks out. 9 weeks out.
Yeah, 9 weeks out. 9 weeks, a little bit under 9 weeks now that I'm out.
Yeah.
But yeah, I mean, the legs are still always my issue. I had a knee replacement years ago, so that leg training sometimes can be difficult, but they've come up quite a bit. And but I definitely feel like I put some size on, so I'm feeling good.
And she's working with my dear friends at Bad Rap. Shout out
Yes.
to Eunice. They are, it's a great opportunity to meet them. Last month when I went to Tampa, it's going to be almost 2 months since I went. And also, she's an inspiration, as you know, Randy Dean, at age 55, women's physique competitor, heart attack survivor, thyroid cancer survivor, inspiration and power, embarking on a journey to the NPC Masters USA, Las Vegas, November the 21st of 2025. If you want to support her, here's a Venmo and her also her GoFundMe. You can go to the site and you can check it out. Because like I said, one thing, being a bodybuilder, it's a very expensive sport, and especially if you have medical issues. Here she is with her coach, Mr. Ron Harris, and y'all been having a good relationship. Y'all, he's really, he's come a long way with Ron.
Yeah, 8 years we've been together.
Yeah, it's more than it's more in some relationships, but not more than your marriage. But ladies, ladies, this is the thing about bodybuilding. As you said, that it did save your life in a way, but then there are some things you sacrifice. What's so much of it is not so much sacrifices, it's an investment. But then there's things you have to deal with, because with your medical issues, like you have to use certain performance enhancers that might be an issue if you use some kind of medication. Your experiences with dealing with that, can you share?
So go ahead, Wendy.
No, I was just going to start with a hot tip to anyone who is listening, because cancer is so prevalent, and you probably know someone who has breast cancer, and Randy had cancer, and whoever's watching, someone in your life who has had cancer. Do not come up to someone like Randy or me and say, yes, my mom, sister, aunt, cousin, girlfriend, sister, whatever, had cancer. and they died. Don't. That happens so much. Don't do that. Don't. I mean, you can tell me they had cancer, they were diagnosed 25 years ago, and they're just fine. Do that. Don't tell me that your mom had breast cancer and died. Please, please. I don't know what is wrong with people, but has this been your experience too, Randy? Like,
Yeah.
inappropriate, just like dumb.
I
Think
get
about this for a few minutes before you say it.
right. Like I get stuff sometimes like, oh, they went through treatment and they lost their hair and now their cancer's back again and they died. I'm like, well, I'm really sorry, but I'm like, I'm trying to be like positive.
I'm trying to get past this.
And I think sometimes people just don't know what to say. And I mean, like, just a big shout out to people. If you don't know what to say, less is more.
Or just simply like just say like, ma'am, can I give you a hug?
Yeah.
And say bless you and just walk away because you don't want to like I said, dealing with my mom when she was sick, she didn't have cancer. She had seizures, she had a stroke. She was kind of like with your situation, Randy, where sometimes we have to carry her to a porta potty. We're lucky enough that her doctor gave her a Hoy lift so she could move around because she couldn't walk much anymore. But yeah, I think some people, you got to use a thing called common sense.
And I think it comes from a good place. I just think that they just I don't think that they know what to say. I mean, my experience is
Right.
that where people are like, oh my God, you're my inspiration. They're like super supportive, when it comes to certain things. But I also think that I think that sometimes that less is more.
Yeah, that makes me feel weird too. You're an inspiration. I'm like, no, I'm not. I'm Wendy.
You're a survivor. That's what it is. I think people get
I'm doing the same thing
you
do because people will feel you. I don't know how you do it. I'm like, I'm not doing anything that's extraordinary. I think most people in these shoes would do the same thing that I'm doing. That I mean, not to say that what Randy's overcome hasn't been extraordinary. It has, but we live life.
Yeah.
It's the same as like when I'd be those first 6 to 8 months just scared of my own shadow. I finally came to the realization that I might have 5 years, I might have 50 years. Do I want to spend that? I'm going to be dead at the end of them regardless. Do I want to spend that time worrying for 5 years or 50 years or living? Right. So that's cliche, but it's true. And it hits you like it's new information. And right. That's where I found, not the courage, but just like, just go on, go live. Yeah. And no one's getting out of this alive.
Right. I think, I think it's not just like a you thing. I think it has a lot to do with your family and support and all those factors. So only because she's got to leave in a minute, I just want to bring her in. Jessica, come on over. She's so pissed off at me right now, but it's too bad. This is what I like to do. So this is Jessica.
That thing this is about being a mama. Say, she's just as pretty as a mama. How you doing, Jessica?
Best wishes to you.
So Jessica's getting married November 1st. So we're in the countdown. So she's learned the term. She understands what it's like to be weeks out. So we talk bodybuilding.
Let her talk a little bit. So Jessica, I know I've been through it. I've seen what my mother went through. What was your experience like when you were seeing your mother going through what she was going through?
Well, the first, so when she got her heart attack, it was obviously during COVID. So I got the phone call from my stepdad and he was like, your mom's in the hospital. She had a heart attack. And I was at my boyfriend at the time, but now fiance. I was at his parents' house and I literally I was just what? What's going on? And I just remember hanging up the phone and his parents at the time really never saw me cry. And so they were they just saw me go completely white and they're what's going on? What's wrong? And I was oh, my mom's in the hospital. She just had a heart attack. And it was the hardest thing to not be able to immediately drive to the hospital because they were my stepdad was you can't come. She's, they brought her in, they did the whatever it was, the stent, and you can come see her tomorrow. And I was just well, I want to come now, but I couldn't come because they were it's COVID, you can't come to the hospital. So that was like the hardest thing. And obviously, like once I was there, we joke about it now, but like I like would not let her do certain things. Like I'm like, you have to recover, like you have to like do what you need to do to like get better, because it's just like it's not worth it to like overwhelm yourself or overstress yourself when you just went through such a big thing. And like she would always like we like I said, we joke about it now. And then obviously like fast forward to when she found out that she had thyroid cancer. And that was just like, in my head, I was thinking like, well, here we go again. Like now something else is like happening. And I was like, well, I'm just going to do the same thing that I did when, she had her heart attack, is I'm going to be there for her. Like she needs me to come to Boston and, go with her to an appointment. I'm going to go with her to an appointment. I want to know everything that I can possibly know, because I don't want to like be out of the loop. I don't want to, basically go into this and be like, I wanted to get more education on it. And so we went to the appointment together. I asked all the right questions, and we both just kind of decided, like she said, like it's worth it to get the whole thing removed, because God forbid if like the other side was not, had cancer or whatever. And I think it ended up.
I had cancer on the other side too.
So, and then again, we joke about it now, but like when she got her thyroid removed, like I was working, and I was able to get approved for 2.5 weeks of PMFLA. So I was out of work. I live like 30 minutes from her house. And I would come here in the morning after my stepdad would leave for work. I would stay here with her all day, and then I would drive home, do this same thing the next day. And like towards the end, she was like, you don't have to come here. Like, it's fine. I'm like, no. Like, I will be there. Like, what do you need? Like, you need me to go to the store? You need me to go grab something? Like, even when she was just like staying here and like napping, like, I don't care. Like, I'm here. Like, I'm here if something goes wrong, God forbid, or I'm just here because I know you need the support.
And to stop me from going to the gym.
Yes. Yeah. Especially towards the end, she was definitely getting very like antsy. We'll just say that word, antsy. But yeah, and then obviously in between, like when she like had a heart attack, and then when she found out about the cancer with her mini stroke, like same thing. I'm pretty sure I got a call from actually her coworker. I was like, who is this random person calling me at 6:00 in the morning? And same thing. She's like, your mom, is on her way to the hospital. Like, we don't know what's going on. And I just remember like calling my boss and like, hey, I'm not coming into work today. Like, I don't know what's going on with my mom. And same thing, like I was by her side, and she was like, you can go, like towards the end, when she was going to get admitted and everything like that, she's like, you can go home. And I was like, nope, I'm going to be right here. I'm not going anywhere. So that's just kind of, I guess, like my side of everything. I mean, it's been, can I swear on here? Okay.
Yeah, you swear. Hey, we're grown folks here, girl. Nah, we're grown folks. You're old enough now. Your mama won't mind. My mama said, some curse words you can let go.
Okay.
Go ahead.
It's been a shit like past 3 or 4 years, and I'm very happy that she is here and is gonna be able to see me, like walk me down the aisle and everything like that. And like she talks about it even now. She's like, oh, like kids and everything, and I'm ready to be a grandma. And I'm like, that's great, but I gotta get married first. But it's just, I'm very grateful to like everyone and who has been there, like her doctors and everything like that like has basically taken care of her, besides obviously me and my stepdad and my entire family. But that's just kind of, I'm very, very, very grateful that she is still here.
It does it a lot of havoc on Jessica, and but I was so fortunate to be able to have her, and I think like in the beginning when I started my bodybuilding journey, she really didn't understand this. And people to this day she'll show pictures. She's like, yeah, my mother's a bodybuilder, and her friends will be like, what? She goes, no, my mother really is. Like, this is like what she does.
Sometimes just get the work and say, that's your mom. Wow,
Yeah.
She got a pump,
Yeah.
Never mind.
Yeah, especially we'll see like pictures, like I'll be like, oh yeah, my mom's a bodybuilder, and then I'll like pull up her Instagram page and I'll like show her like a recent picture that she posted, and they're like, damn, your mom has a nice back. And I'm like, all right. I'm like, okay, that's great.
Yeah,
Like-
she got a nice back. Something else too, but we gotta be nice to her. But yeah, sweetheart, I can feel you because you know what, I've been through it, and we're taking care of my mom. And you know what, I'm uncle, a great uncle. If you were one of my nieces, I give you a big hug, baby. Say thank you for doing what you did for your mama, because you know what, it's much appreciated. You know, my mama was my woman. You know, and when she left, I mean, I'm all right, but I miss her dearly. And I can understand when she was in the hospital, she had got C-19 herself, and my sister, she one time we talked to her through a video call, and it was the same as like when I used to go when she got sick. I was at the hospital sitting there till she was ready to go home, or you know, and it's tough. It's tough, and when you understand because you also have a daughter, and also your grandma yourself.
Not that I know of.
Oh, I thought you. Oh, I forgot. She has a dog. That's nah, that don't count.
I got a granddaughter.
That don't count. That don't count. But yeah, I mean, sweetheart, that is a thing that you stood by your one true woman in your life. That's your mother. We can never. You can always say you get married now. You can always get another husband. I know you love the guy now, but marriages come and go. I've never been married myself. I did what I did as a man, but never been married. But I would say, as if I was saying again, if you were one of my nieces, I say thank you for doing what you do for your mama. And I know she appreciates it. We're not gonna hold her too much up because I know she got a life, she got a man. So you say, "Where my girl at?"
She's got her wedding stuff to do, but I did want to, since we were talking about, I mean, she was such a big part of this whole thing. And I'm so fortunate that I have had her. And she, even in my worst of worst days, we kid about a lot of things, but she's encouraged me 100%. I would think, right, just to continue with my bodybuilding. She encourages me to go for a pro cut. I don't know if she's really happy about Masters USA kind of happening, kind of that I'm in prep right now around her wedding. We're dealing with it. Okay.
You're doing
This is what I tell you. This your mama got to do what she got to do. She grown. She don't got to explain nothing to you.
Yeah.
She had you. You need to have her.
But I'm extremely. I'm just. Thank you for allowing her to share her story.
Not a problem. Not a problem.
It's just without her. And again, she's my baby. She's the only one I got. So without her, I don't know sometimes where I would be or what would have happened to me. Husbands are great, friends are great, family is great, but this is my own. And for her to go through it. So I think if there was ever a pro card to be awarded, my kid gets the daughter pro card because she's.
I would say it's
Will you be at your mom's show?
No, I wish I could go to.
She got.
It's literally like 3 weeks after my wedding.
Yeah. It's honeymoon time.
But she will come to my first pro show, hopefully, that I do. Yeah. So she will try to travel out to that. So, all right, get out here, go do your wedding.
Yeah. Thank you, baby. Thank you. No, thank you. You did a good thing for your mama. And I tell you the truth, that really touched me because I'm a big man. I can cry too.
Thank you for allowing her to share. It just happened to be that she was stopping by. She's picking up some pictures for something for the ceremony. So when she was here, she hates when I do that. But
well, the thing is, I know my mama did stuff to me that I hated, but you know what? I think about it. I love. Like I said again, that was my woman. Like I said, I remember a long time ago. I used to work at this plant, textile plant. I worked with women for a long time, from the textile plant to the strip club. I worked with women. And I remember this one lady I used to work with. She told me this. Said, "George, you live with your mama, son?" I said, "Yes, ma'am, I do." I said, "Well, son, stay with your mama as long as you can. Do what you got to do as a man, but come home to your mama." And that's what I did. That was
I'm blessed and I'm fortunate, and I'm just because those days, like Wendy talked about, where you're just I mean, there were times, and I'm sure that Wendy can relate to this, where like I don't know if I want to live anymore. Like I got to that point where I was like so down that I was like, man, I'm like, all right, I got through the heart attack. Now it's the freaking cancer. What's coming next my way? I put on all this weight. The one thing that I love to do, which is my training, I can't get the weight off. I don't feel good. And I just felt just desperate. And I got into a really bad headspace. But again, I'm just was so fortunate that I was able to with my doctors adjusting things, be able to do that. But like Wendy says, you never know when it hits you.
Yeah,
Yeah.
right.
Just,
First thing I did right after the diagnosis, well, one of the very first things, I got a prescription for Xanax, which I don't take anymore, and antidepressants, and it's helped.
yeah.
And I'm about to, I think, switch antidepressants because I don't know if any of your medication gives you pain. Sorry, I'm chasing rabbits now. But I've read that, AI told me that Cymbalta can help nerve pain. So,
yes. So one of the uses for Cymbalta actually is for people
yes.
with
Yeah, well, you're a nurse. Yeah. So,
Yeah. See, that's a good thing I have it here. So we have somebody who has a medical. Yes, that's a good thing.
Yes.
See, as I often tell you, ladies, as my master Ra's al Ghul taught me, be aware of your surroundings at all time, young Master Wayne. Never give sure footing for a killing blow. So yeah, that's true. Some medications can be some side effects. Because I do take, with me, I got heart medications for like blood pressure, stuff like that.
And that's the problem too, is like when you get onto some of these medications. So one of the medications that they've actually put me on is Wegovy. And people look at me and they go, why would you be on a GLP? Like we don't get it. Like, why? I have no metabolism, and it was affecting my thyroid functions, and I actually had fluid around my heart. And one of the things that they're studying is like the metabolic effects with it, and they're also studying with the people with cardiovascular disease what the benefits to GLPs are. So forevermore, my body will produce cholesterol. I can eat clean and healthy every day. It doesn't matter. Like body just,
Remedex does that too.
yeah.
I take
200.
Right now, I'm taking Majono because it's cholesterol issues is genetic, because especially I'm Black. We are higher numbers of cholesterol. But like I say, my older sister Mary had a stroke. My mother had a stroke. My sister had a light one. Both my sisters had stents. My brother had issues with his heart. My father died of a heart attack. And we are more targeted with heart conditions than anybody.
Right.
And I take Majono because my doctor says it's good to control my cholesterol. Also, I'm pre-diabetic because my mom was diabetic. Well, my sister, she's diabetic, and it's good to help you because I just went to my doctor this past Friday, and everything's pretty good. Last week I went because one point some of my medication was out on. I had to get it updated and get my refills, and my sugar's good, my blood's good. Just the thing I got control of is my cholesterol. The problem is I'm a fat dude. I have bad habits. I try to be, because with you ladies doing this content, I really learned some stuff about how to eat a little clean, a little smart. About. I'm not trying to be a bodybuilder. I am trying to eat a little better because I did lost about 12 pounds. I did pick up a little weight a while back because I do have issues with my knees. Because I got knees like Stone Cold Steve Austin, and I'm right now I'm seeing a specialist. I'm going to go back to him at the end of the probably first of the month and get some injections in my knees because I need to really move around a little more. Sometimes I feel like rest in peace to the great Ozzy Osbourne. I feel like Ozzy, he had what was it that Ozzy had? Parkinson's. Yeah. And it feels like my body's just because I've worked most of my life since I was 10, 12 years old. We not like did little farm stuff like that. We grew up we were sharecroppers and we did a little work here and there. I did as much like my brothers and sisters did, but I did a good bit of it. But still, we had to chop wood, pump water, do stuff like that. We were poor, and doing work is like this, and then having a job by the time I was 16, and then working, at a textile for 13 years, working in a club for 7, 8 years. I had a bunch of jobs, and it's kind of my body is a bit worn down, but I'm doing better than I was before, and it's a good thing that I'm taking care of myself now because I was taking care of my mom, and that was when I was almost 500 pounds because there was so much stress dealing with her stuff and trying to keep the house together, keep things together, and and responsibilities, and just as if y'all follow me, I just got myself a CPAP. I had one before, but because I didn't do enough hours, and sometimes you get in the middle of the night and have to take care of her, and then I get back in the bed and you just go to sleep. But now there's things that I have to take care of me, and I can understand that some days you lay saying, "What I'm going through." I mean, there's things where I just if I'm gonna wake up, I'm going to die the next day because I know people who have something like sleep apnea. Sleep you can stop. Your heart stopping to sleep, you can die. I mean, I can feel you on that, but it's good, even though I don't have, like, you two have the pleasure of having children. I don't have that. That's one of my biggest regrets, not having any of my own. The closest I had was, well, one of my youngest nephews. We took him in for like 2 or 3 years, and I saw my son. But it's good that your daughter was there for you, and your daughter, Wendy. What was her experience? Because she would talk about it with you, what she was going through with your stuff.
She's let some things out now that it's behind us, like all the diagnosis and then the surgery were like 7 weeks apart, which is like a dog year, right? It's like it's forever, because as soon as you find out you have cancer, like take it out now, do it now, and so that time was really tough mentally. My daughter during that time was, it's fine, you're gonna be fine, look, the statistics are, you're gonna live, everything's gonna be fine. And then also during that 6-7 weeks, you're like, is it spreading right now? Is it metastasizing? It could be doing that right now. I mean, this is my brain, right? And my daughter was there looking up, no, it's not what's going to happen. When everything was said and done, we had them over for dinner or something, she and my son-in-law, and she said something like, I was worried that it was going to travel to my lymph nodes, which it didn't. They tested the sentinel node or whatever, but she said, I know, I read it's like only in 3% of the cases. So I'm like, oh, she let that out, that she did do all that research, like behind the scenes, but to me was all like, it's going to be fine. So she was a little worried. My mother died of breast cancer. So when my daughter was 17, I think too, and they were very close. So all of this was still sort of like you're rubbing salt in a wound here, So she did step up for the entire process. 10 days after my mastectomy, I developed a staph infection, which is not unheard of. It can happen. And my fever just shot up to like 105. Ooh. And yeah, from like in the morning, it was like 99. And I had an appointment the next day with the plastic surgeon, because, well, I'll just wait till tomorrow. And it was like, it kept going up. And I'm like, calling them. And then it was they're about to close. I'm like, it's 105. And I'm taking Tylenol. So if I have autism, sorry, but, so, and it was that high with the Tylenol. So, they finally said, go to the ER. So I called my daughter, because I don't think I could drive then. And I wasn't feeling good enough to drive. She dropped everything and just boom, came and got me. And just like, wow, all those years of me showing up to your school plays, it's paying off. So, and she brought me to the hospital, stayed with me until they decided they were going to keep me overnight. And I had to, push her out, like, go. And so, yeah, she really stepped up more. I didn't not expect her to, but I didn't have any expectation. It was, and especially as a kid, you're the one who's doing stuff for them all the time. For that to turn around is hard, but I mean, it was sort of beautiful. It was like, oh, she does love me, or
like it's surreal when they do that. You know what I mean? Like,
yeah.
You said, like, it was the same thing with Jessica. All those years of doing like whatever, and not that I didn't think that she would be there for me, but I was like, holy shit, she's like right there, and she's a big girl. You know what I mean? And she's in with the questions and like asking things, and I'm thinking of her as like my 3-year-old. You know what I mean?
Right.
And
I stayed at her house, for a couple of, and I couldn't shake it though. I stayed at her house for like 3 days. They wanted me to stay with someone for a week, but I'm hardhead, so I stay with them for
amen.
For 3 days, and it's like, oh, it's time for my medication. I'm getting up. She's like, Mom, stay. I'm like, no, I feel fine. When I'm getting up and I'm getting my own medication and stuff. But if anything, she wanted to do more than I wanted her to. But it was just quite the experience, like you said.